to my channel. My name is Lisa Alastuey, and on this channel, you will find a variety of inspirational and informational videos. If that sounds good to you and you haven't subscribed, please subscribe. Today, my guest is Dr. Kate Schuh White, who has an MD degree from the Medical University of South Carolina and a residency in the University of Texas Medical Branch. She is a board-certified menopause and sexual medicine specialist with 25 years of managing and treating menopausal symptoms and specializing in sexual medicine. I will be linking all her contact information down below in the description box. Welcome, Dr. White.
Welcome to you. I'm so glad to be able to meet with you.
Yes, I'm super excited to talk to you. Can you share a little bit background about yourself?
Sure. So I graduated from our residency in 2002, and I did a residency at a place that it was fantastic for obstetrics and also for gynecologic surgery. That's really the hard hitters when you're in residency. Is that everybody wants your numbers, right? You want to be able to. I delivered 2,000 babies before I left residency, and I did 500 hysterectomies before I left residency. But nobody really cares how many people you put on hormone therapy. And so, and at the end of 2002, once something happened in the menopause universe, the metaverse, we say, that actually was devastating for women. And it was the release of a study called the Women's Health Initiative. And it was the biggest study on hormone therapy and menopausal therapy up to that point, and really ever since then as well. And it came at a time where actually there was a lot of people using hormone therapy. It actually was the number one prescribed drug in America. And ostensibly, this study was looking at cardiac disease because they knew that for up until the time of menopause, women's cardiac risk was much lower than men. And then by the time they got through menopause and 20 years beyond, it equaled men. So they're like, hey, we want to prove using our drug that every woman in America, not even that a lot of them are on it, but we want everyone to be on it. And so they said, okay, we're going to do this huge study. And we're going to use the drugs Prempro, because we'll give the drug to everybody for free, so we can get this study done. And unfortunately, what happened was the study started, and they started seeing increased incidence of heart attacks, strokes, and so they stopped the study early. And everyone that heard immediately, it actually went out to the media outlets before it even went to the journals, which is not the typical way that medical information gets dispersed in the United States. It typically goes into a journal to be peer reviewed, and then they look at the data and they say, what's going on with this data? And then it would be released as a press release and everything. And so, and for most things like hip replacements and valve replacements in your heart, the general public doesn't care about that, and so it goes to the journals, and they're fine with that. But this went out, and immediately it went to the Today Show, it went to the cover of Newsweek, and everyone immediately blew up. Get off your hormone therapy, it's going to kill you. So that was 2002. That was when I was coming out of residency, and all the menopause specialists that had been looking at these things for years said, wait a minute, this information doesn't make sense for what we see clinically in women. And so but their voice was dim, dim, dim. What it did wasn't a big headline. So everyone, the prescriptions for hormone therapy plummeted. Everyone took their patients off of hormone therapy. All the family practice doctors, the internal medicine doctors, they told everyone to stop their hormone therapy immediately. And that continued for the next 20 years. And until the last 2 to 3 years, we started to see that these small voices come up and say, hey, let's look at this data. Why does this data not make sense? And they said, well, it was the wrong patients they were looking at and the wrong medication. And so this unfortunate combination, they looked at women, the average age of the women in the Women's Health Initiative study was 62 years old. So that is not the age that we typically would start people on hormone therapy. At that point, they already had significant cardiac risk because of what estrogen does to protect the heart from laying down cardiac plaques and making the blood vessels more elastic. So once that horse had left the barn and they already had these cardiac plaques, the estrogen that they started at 62 came in and loosened those plaques, causing a clot and giving them heart attacks. So
Mm.
it was very sad because what happened after that is all of our mothers and that whole generation of women, if we look now, has had increased risk of much higher increased risk of fractures, younger age of heart attack and heart disease, which is the number one killer of women, and they've been denied hormone therapy for all the things, the brain fog, the hot flashes, the night sweats, the sleep disruption, and all those things. So I was among those who had very poor teaching in residency to start with. And
Mhm.
then when I came out, everything I heard from the governing bodies, the things like ACOG, which is American College of Gynecology, what did not give us anything to help support women. And it really was just got to tough it out, take some SSRIs. You know, here's some blood pressure medicine to try to help with those night sweats and hot flashes. But now we are at an amazing time for women because we were finally getting back to the data that can help us to try to get women the care that they deserve to improve that quality of life for them.
Yes, I'm glad you outlined that because it can be so confusing as a patient, as a customer,
Mhm.
trying to weed through all of this information, misinformation. You go online and you hear one thing and then you hear from another thing. And so I'm glad that you laid that out. And I'm so happy that we're in a better place because today's topic, when I reached out to you, so I wanted to touch on the positives of menopause
Oh, absolutely.
because people are, you don't have to look far to see there's some negatives that you have to overcome and so forth.
Mhm.
But I wanted to do something more uplifting and something that can be, valuable to women out there who might, be on the fence about what do you mean there's positives to this?
Yeah, I think it's so interesting because when you look at menopause and how menopause has historically been viewed, at least in the more recent times, and so if you go way back historically, you'll see that we the grandmother their older women were that were helping to care for families. There was a lot of positives to having a grandmother around, having someone to help care for the other people in the family. But more recently, when you get a little bit closer to where we are now, we see that a lot of women were seen as frail, dependent. When you're looking for a place for mom, it's really more of the seeing them as more of a burden than the supportive, positive image. Well, now we're starting to have a new renaissance where we're seeing that women like we our role models now are not the golden girls who were in their 50s but looked like they were in their 70s. Now we've got Martha Stewart, Oprah
J-Lo.
Winfrey. Yeah, we've got all these women who are uh, really taking control and saying, our whole lives we've been told to reach out and capture our health, find the right exercise, find the right diet, get yourself optimize your life and your strength and your direction.
Mhm.
And so I think that's where millennial and Gen X women, which I'm Gen X,
I'm J.
I think, yeah, I think that is we're saying, okay, we've been told our whole lives that we can go reach out and get it, and we can reach out and do it. And if we find the right direction and the right tools, we can. And so It's just finding the right tools because at this point in menopause, our brains have changed, brain chemistry has changed. And if you look at the work of a brilliant doctor, Lisa Mosconi, who has a book called The Menopause Brain, which I think is one of the most fascinating things out there, our brains actually do change at this point. We are more empathic, but our empathy now, from going from empathy to emotion, goes more to empathy to rational response, which is letting us be able to focus our our feelings and our desires for helping ourselves, self-care, but also helping our community in a very focused and rational way. And so we're able to harvest all of our experience and then put it towards the energy and direction that instead of just carrying, doing the million things in a million directions, we're able to focus now onto the things that mean most to us.
Love it, love it. You know, one of the big things is mindset. That's what I'm seeing. I'm 50, and a
Yeah.
lot of my friends in my age range, the ones that are aging gracefully have the best mindset around it,
Yeah.
versus, kind of that negative self-talk and everything's bad and I'm just, getting worse. I'm getting heavier. I'm, not sleeping good. Instead of always focusing on all of that, they're taking control of what they can focus on, but it starts with that mindset.
It is, and trying that self-image of someone who is now ready to redirect and secure that future and take hold of it and know that's the direction we can go. But it is hard to sometimes to find those tools, especially because there are when we look there in perimenopause, we start seeing a 35 to 45% increase of anxiety and depression
Mhm.
with it with some of those hormone changes, and that can really wreak havoc on how you are your direction. And in fact, when we look at some of the health studies, you will see that time of perimenopause and menopause, a decreased satisfaction in life satisfaction and decrease in happiness. But it actually, if you look at, several really good studies. There's an Australian healthy aging study that looked at women's health and satisfaction. And actually, after menopause, which would be that time 2 to 3 years after menopause, you have a 62% increase in happiness. And they had 50% of people say that it's the happiest they've ever been in their life. So then that's reinforced by in other studies out of Denmark and things, and I think it's because you of this brain chemistry change that you are seeing where women are refocusing their direction.
Yes, yes. I've noticed like women of this age group definitely have more wisdom, more self-confidence, their voices finally being utilized. Maybe they've, held back because they were peacekeepers or whatnot, and they're finally stepping into their power and standing up for themselves. And I see, some of them making huge life transitions at this age that are definitely for the positive as you go down the path of life.
Yeah, I think that we see in writers and Margaret Mead called it menopausal zest, where you're able to regather all your energy and focus it when we've had it scattered for so many years in caring for so many different people in so many different ways, whether it is in our jobs or in our personal lives. Of course, there's lots of people who still have lots of people to care for at this point, but you're able to focus a little bit more on on your direction, like you said, and self care.
Definitely. And I've also seen women, develop new interests, new hobbies, new passions that they might not have prior because they were doing, raising the kids or whatnot, but they just definitely are stepping into like a new chapter of their life.
Yeah. Some of the other things you see is you're actually just not getting the hormone swings that you used to get so tremendously, that monthly where you're where or and some a lot of my patients who deal with significant pelvic pain, significant bleeding, just getting rid of your period and those hormone swings are a huge liberating factor for a lot of women, and that can lead to a lot of I mean, there's some of my patients who I've talked to, and they'll be schedule their whole lives around that, so 1 week out of 4, so 25% of their life, they're scheduling around when they have their period and
Yes.
trying to make and the changes that they get, and some people can't get off the floor from cramps, or they can't get off or the mood changes are so severe. So that is a freedom too, that you move on from that, and you're able to be a little bit more steady. And I
Yes.
think that is able to lets you to focus more.
Yes.
Um,
You know, the fact that you can't get pregnant and you're not
right?
wanting to get pregnant, the fact that you're
Mhm.
not having periods anymore, this can all positively impact your sexual health, your sexual being.
Absolutely.
Can you talk on that a little bit?
I would love to. Actually, that's a big part of what I do and talk about. So when we look at sexual function, in menopause, I would say menopausal, there is it's very common to have, especially if you've been in a long-term relationship, which a lot by research has a long-term relationship is 6 months or longer. So if you've been in a relationship more than 6 months, you have a decrease in spontaneous desire. So I
Mm.
hear that all the time, right? I mean, I'm sure we talking to friends, that you don't want your foot to touch his foot just in case they might think maybe you want to have sex, and you're like, so we want to say, okay, well, what am I going to do now that I want to maintain this relationship, but my brain has sort of shut down that desire center. Now I'm not able to get pregnant. I'm not able to get, not bleeding all the time. My pelvic pain is better, but I have no desire to have sex with this person. And so there's several other things that we look at. We say, okay, well, first of all, one of the things you do need to do is make sure that there's no pain going on that's causing you to have any decreased desire. And whether that's vaginal dryness or changes in the muscular tissue, or some of those, if you've had chronic pain with periods, that whole pelvic floor can be spasmed and very painful. And certainly you can talk to your gynecologist about pelvic physical therapy or vaginal estrogen, and working with pelvic physical therapist to work on that muscular pain in the vagina. But vaginal estrogen is incredibly underused. And it isn't just if it isn't just if you're having pain with intercourse, then you should use a lubricant. You should repair the tissue of the vagina. Vaginal estrogen does not increase the risk of breast cancer. It does not increase the risk of blood clots. There's essentially no one who is not a candidate for vaginal estrogen. So even if you weren't going to do any other hormone therapy and you are worried because your mom had breast cancer, vaginal estrogen to repair that tissue is not going to increase that risk. And
Is
that's
that a
very
cream that you're talking
You can
about?
do a cream, you can do a tablet, you can do a gel cap, you can do a ring. There's all these different options that are bioidentical. So a lot of people don't realize that the amount of estrogen in a vaginal estrogen replacement for 1 whole year is equal to what's in 2 estrogen tablets.
Wow.
So, but it actually locally to repair that. And there are great vaginal lubricants in there, and we can put some links to some information about that if you want. But really fixing pain, because this is your biggest sex organ for sure. And if your brain's like this is going to hurt, they're never going to get any desire.
Mhm.
Um, that is the number one thing that I talk to patients about. So until we get that, there's nothing that you can do. But even for patients who do not have a partner,
Mhm.
Keeping that tissue healthy is so even for we call it self-cultivation. I love Kelly Casperson, Dr. Kelly Casperson. If y'all are not following her, you should. She's a great urologist and sexual medicine doctor. But
What was her
um,
name?
Dr. Kelly Casperson,
Okay.
Casperson. So she calls it self-cultivation and that's so because not all of us are partnered, so if you maintaining that tissue with vaginal that vulvar tissue, the vaginal tissue, the clitoris, all that is important. And some vaginal estrogen twice a week can help to maintain it, but also keep you from recurrent UTIs and things that are become life-threatening as we get older.
Yes.
Um, so so sorry, I'm kind of wandering
No.
around, but the vaginal estrogen is a huge thing and is not dangerous and should it be something to consider. The other thing, once we look at desire, there are some medications, and they're actually not FDA approved for postmenopausal women because they have not done the FDA studies. But there are medications that act centrally at the desire center of your brain. So, in terms of decreased desire, I don't know if you've ever done any sort of elimination diet, like you say, okay, keto is one,
Mhm.
or sugar busters, or one of those where basically anything that restricts, cut something out. And
Mhm.
so when you start out, you're like, oh my gosh, I would kill for a Snickers. And then like 3 weeks go by, and the desire center that's been sending off this message for sugar, 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 de- if it's not getting a response, it's like it down regulates. And so then after about 6 weeks, you're like, ooh, Oreos don't even sound good to me, which I actually can't imagine. But so it is the same thing as if you are not having sex because you are way too busy, or you don't have a great relationship with your partner and you guys are pissed at each other all the time, or you've got, by the time you get through work and soccer practice and trying to get people fed and in bed, you just have no desire. Your brain no longer has that trigger. And so so there are medicines that can work in that desire center. One is called flibanserin, which is Addy, which is an oral medicine that you take daily. And then there's another one called Vyleesi, which is an injectable medicine that you take 45 minutes, use 45 minutes before you want to have sex. If you know 45 minutes before you want to have sex that you want to have sex, which is
Right.
sometimes, yeah. But these are some options that I think a lot of gynecologists do not talk about with their patients, because it takes time to talk to patients about sexual medicine, and they don't have if you are even willing to bring it up, either a lot of them are not informed about them, or they definitely don't have that time in the 15-minute spot that you have for your annual, and
Mhm.
it's almost certainly the very last thing that you brought up because
Mhm.
because because it is awkward and we're not raised to talk about these things, and if your doctor doesn't bring it up, you may not even feel comfortable bringing it up.
Mhm.
But you deserve to talk to somebody about it, and you deserve to be able to get the information about it. And there are a lot of good resources. We were talking a little bit about how much more is available in online and through different resources.
Mhm.
As I said, Kelly Casperson has a podcast called "You Are Not Broken," and because that is what women feel like. They feel like I'm broken. I'm
Yeah.
definitely why is there's this why do I have such a mismatch? Even though in my head I want to have sex with this partner that I love, I just don't feel it.
Mhm.
And you can work on getting back to that and feeling better.
So I was going to ask you, because the libido is an important one, and I know like husbands, boyfriends, listen up. This is
Sure.
also important for you to know. But I know some doctors have been prescribing things like
Yeah.
testosterone pellets to improve libido. What are your thoughts on that?
So the data is all over the place, really. So when we look at the North American Menopause Society and ACOG, they do have position, and ISSWSH, which is a International Society for Women's Sexual Health, they do have position statements on the use of testosterone. There is support for it in premenopausal women. But we just have so little data on postmenopausal women. And that's a whole nother problem, is that we don't have the studies in postmenopausal women that we do in premenopausal women. And we don't, and then even the ones we have in premenopausal women are pretty minimal. But testosterone definitely has shown positive effects on well-being, bone density, all these different things, and it is indicated for decreased libido. Uh, Really, the problem with testosterone is there's no FDA-approved testosterone for women at all. So women that are getting it are getting it off label, and it can be very difficult to get because the pharmacies are not prepared to provide it, and so what we can get that's FDA approved, which is what I do recommend to my patients if we are using the testosterone, because I do use it all the time, is trying to get the male FDA approved medicine, and women use 1/10 of the dose. So what they use in one day, it lasts us 10 days. And you can get it, but it is going to be harder to try to get, and most practitioners are not familiar with how to get it and how to prescribe it. So what happens is they will go to get testosterone pellets, or they'll get compounded testosterone from a provider that's actually willing to work with them and is familiar with it. The compounds may be what's available. And if that's the case, that's what you should do. But I would, the compounds are far less consistent. So even when they did testing of compounded medicines, and when we're talking about compounds, I don't know how some people are not as familiar. Basically, what a compounded medicine is, it just means that the pharmacist gets a big bottle of, let's say, estradiol, or which is estrogen, or a big bottle of testosterone, and they get a big bottle of lotion or whatever their substrate, the vehicle for that, and they mix it together and put it into a container. So I think there's some thought that compounded medicines are safer, but they're not. They're just the same medicines that you get from CVS, but they are just mixed up by the pharmacist in there. So that gives a lot more room for error in what you're actually getting. And also sometimes those medicines, if they are in, let's say, a gel, they don't stay in solution as well. So you've got at the top of your jar, you've got barely any. And at the end of your jar, the end of the month, you're getting these huge doses. And so even in the very best compounding pharmacies, when they did testing on them, they're very inconsistent dose to dose.
Mhm.
So that being said, in a very long way, if you can get an FDA approved product, the benefit of it is that you have to prove to the FDA that this dose is equal to this dose is equal to this dose. So you know what you're getting is what you think that you're getting. But again, there are bioidentical FDA approved products that you can get for estrogen and progesterone and testosterone. They are commercially available, but sometimes it's hard to find a practitioner who is able to prescribe things. But you should hopefully just keep trying, because they are out there. And how do you find one of those? If you find someone who is NAMS, NAMS, well, they just changed the name. Now, North American Menopause Society has just changed its name to Menopause Society, which is, we'll see. Well, it's still a transition. But the NAMS certified providers, not universally, but they should be well versed on getting you things that are
Mhm.
Bioidentical and FDA approved, and because that is what's recommended for most people. Pellets, that's a hot button, because there are testosterone pellets and other pellets in general. Very frequently will over replace people. There's no testosterone pellets that are made to get women into the range of hormone levels that is recommended for back to like premenopausal. They super over replace very frequently. And a lot of people feel great with them. And I'm not saying to not do them if that has been working well for you. But it is typically higher doses and than are recommended in general.
Yes, that's really
Harder
good.
to control.
Yeah,
Mhm.
that's really good advice. I know that, like, as a patient going to see a doctor, it's so important to have a good relationship with your doctor that you feel like you can talk to them. There's no shame or stigma. You can bring up these sensitive
Yeah.
topics. And, obviously, if you don't find that rapport with your doctor, get a second opinion. Can you talk a little bit about your own experience working with patients and how maybe how do you
Sure.
get them to like open up and it's okay to talk about these things and so forth?
Yeah. So it is amazing that it doesn't take a lot. So one of the things that I do for every single patient is I have just an intake sheet that lets them circle things and not bring them up.
Mhm.
So they circle. I have all these questions on what things you are just things that are going on with you. You don't even necessarily that not asking, do you want to talk about this today? I'm just saying, do you have any of these things going on in the last 60 days? And once they do that, it lets me say, hey, I see you've been having this problem. Would you like to talk about it?
Mhm.
And sometimes they're like, no, I'm fine. I don't have sex with my husband, but I don't want to have sex with him. And I'm like, okay, that's fine. But it's all 99% of the time they'll say, oh yeah, I have been having that pain, but I thought that was normal. Or
Mhm.
I thought that would, yeah, yeah, but it's okay once we get past the first couple of minutes or
Mhm.
those kind of things. And I'm like, okay, we can fix that. We can make that better. And sometimes it is that we get started just a little talk and then we say, okay, I will meet back with you. There's a lot to go over here. Let me just give you these resources to read. And I'll refer them to some great resources like Estrogen Matters, which is a book by Avram Blooming, or Mary Clara Haver's book, The New Menopause, or Lisa Mosconi's The Menopause Brain. And it's amazing. I'm like, hey, listen to it as an audible. You can listen to it as you're driving around your car. And then let's meet back. Once you kind of get a little bit of background, because I am a full on OBGYN functioning doctor, still doing delivering babies and all the things and surgery and all those. And I am working in the constraints of current United States medicine and insurance. And so we have these 15-minute spots, and typically my front desk will overbook about four of them. And so I've got two people in one 15-minute spot, and I have to chart so I can remember anything. And so you got to count on, if you're going to someone who is not giving you I mean, you can pay a $500 or $600 menopause specialist that is like a concierge person, and that's a great thing, but not everybody can do that. And but if you are not doing that, then you really have to understand that you are going to need to do some education of yourself, and then come back and talk to your doctor about and the doctor's not going to be able to do everything in terms of education in the time that's allotted that with our current model of care.
Yeah.
But you should be able to get the care, and you should be able, and there's a lot of information out there now, which there didn't used to be in the 20 years ago.
Mhm.
So we're
Excellent.
living in a lucky time for that.
Yes, yes. Another area that I see some women maybe struggle with that we want to give it a positive spin is on their body image.
Mhm.
There's one resource that I absolutely love. Her name's Midlife Muse. Have you heard of
Uh-huh.
her?
No, but
Okay.
I'll look it up.
Oh no, she's amazing. She's always talking about, aging gracefully and in stepping into
Mhm.
your age versus trying to fight it. There's a lot of women that are trying to freeze at 50 trying to look 25 rather than
Right.
just like, really embrace and be grateful for the lines and the gray hair and and letting your grandchildren see your face move and like all of these things. She's amazing. So can you touch on that, how some people can actually get more confident with their body at 50?
Mhm. Yeah, I think that that is some of that brain restructuring, which is helpful because it does frequently give us a lot more self-acceptance. And it is hard to make that transition for a lot of people. And I think that having the community, like you were saying, having something like the Menopause Muse who's out there promoting that sense of community of, hey, we are all doing this together and we are all moving in the same direction. Uh, but that is a huge part of being able to have that self-acceptance. If you are just on Instagrams, the scrolling through the people who are on yachts and going to the Met Gala, you're gonna you need to find that community that is going to be looking for the same things you're looking for and looking for like you said, the mindset of trying to move through this transition into the women that we're going to become. And because it really is, it's the biggest part of our life, it's the longest part of our life for most of us. And there is much more community out there that will give us the support for aging gracefully. I love that. I mean, that aging gracefully is a goal that is less of it's less of reactive than it used to be. So it used to be like, go over here and age gracefully.
Yeah.
Or go over to this area and go have tea with your friends. Now it's go out and walk the bridge with your friends
Yep.
and enjoy your time together and find the projects and things that you've wanted to focus on that you haven't been able to.
Yep. I hear some women say they feel invisible during this time, and there's no way you should ever feel that way. And so that's that mindset. Stop that. People still see you. Find the people that see you. And then just on the last note about, what type of legacy are we going to pass to the next generation of women? What do we want to, what messages and lessons do we want to send them? I think our generation, Generation X, is doing a better job of aging, especially with maintaining bone and muscle health compared to our parents because we're working out more. Those are the types of things that I hope get passed down, not like keep putting toxins in your face and fillers. And I mean, I get it, people are going to do it, but like,
Yeah.
what are we teaching the next generation?
Yeah, I think that is a very good point of our children are always watching. Everyone and if you see and our children are now in their 20s or in their 30s, yeah, for some of us, and they are watching how they've been watching and they are watching what our attitudes to this as well. And how we want to live our lives at this point, where we're going with it. I think that the focus for us has always been more on health than it was for the generation before us.
Mhm.
We've been always a little bit more attentive to how can we make this better? How can we be more fit? And the bone strength, the cardiac health has always been more important. And our kids see that, and they'll be carrying that forward. But also just that how you reach out to your community and how you support the community around you is what they're watching too. So I think that hopefully Gen X is doing a good job with that. I'd
I
like
think
to see
so.
that.
Yes, definitely. So I have a question about maintaining that muscle health.
Yeah.
Here's the facts of the matter. As you get older, you need to like keep exercising. It isn't like
Mhm.
you ever reach a final destination with it. And it becomes even more challenging. You might notice muscle tone go quicker,
Absolutely.
whereas
And I do think we see testosterone as part of that. Is it when we see that testosterone go down, you do see some of that muscle recovery slow and muscle mass slow. And so some of my patients, that's their primary reason for starting testosterone is for that muscle tone and muscle recovery. But we also see that the joints become the joint pain, frozen shoulder increases in women in menopause. So there's something, Dr. Vonda Wright, I don't know if you know who that is. She's an orthopedic surgeon who works a lot in menopausal medicine, and she has coined the term musculoskeletal syndrome of menopause for the uh, inflammation and stricture that we see in women, and the with the tendons and the joint capsules. And I think we all feel that when we try to get up and start out and you're stretching more and your muscles feel tighter. So some of those things are going to be uh, lifting. You really have to do the stretching. You have to do those things, the balance, the stability, consistently. And I know that it is easy to let those habits lapse, but the heavy lifting, the trying the stretching, you really need to hit all of them. Some
Mhm.
people, lots of my patients I hear, they're like, I'm like, are you doing anything to any exercise to protect your bones? And they're like, I walk every day. I'm like, that's not good. That's good for your heart, but it's not enough for your bones. And we need to get you doing some resistance exercise,
Mhm.
and it doesn't have to be complicated. But it could be some resistance bands that you keep in your bathroom,
Mhm.
and you do your stretches and your leg stretches every day. But we're if the frailty is like, I'm like, you don't want to be frail, right?
Mhm.
And they're like, no, I don't want to be frail. And I was like, well, this is how you won't be frail. And I think that image that they have in their head of their grandmothers and the frailty that we saw in the generation before is not is one of the most powerful motivators for them to maintain that muscle mass and try to do it with, and we don't, and get the protein and get the um, resistance exercise.
Mhm. Yeah, because falls can be deadly, just by
Mm.
not having strong muscles, not having the flexibility, the stability, all of that. One concern that I have, especially for women this age group, because we know obesity is off the
Mhm.
charts in America,
Yeah.
like 42% last time I checked, of Americans are obese, one third are overweight. And so a lot of women might be gaining weight during this time, but it might also
Mhm.
be an indicator to get really healthy at this time. So
Yeah.
you don't have to go on certain medications like the Ozempic, because I know people who start that might actually lose lean muscle tissue when
Yes.
they're on it. And so I just see, more falls happening in the future as more people go on this and then they don't change their lifestyle behavior habits.
Yeah, it definitely, you see when your estrogen levels go down, you get a change in three main things. One is your triglycerides go up, which is what and your sugar metabolism is poorer, and your gut microbiome changes in terms of how it metabolizes. So you've got these three things that are changing as your estrogen levels go down. And all the time, I've got patients who will say, I'm doing exactly the same things, and then I've gained 5 pounds. And I used to be able to just do the things I did where I'd be like, "Oh, okay, I'm gonna eat just grapefruit for a week," or whatever horrible plan, and it's still not coming off. Or even people who are like, "I am running 6 miles a day, and the weight is coming out," and it's because your body has changed its way of metabolizing. So you do have to adjust how you're eating. You have to adjust, the fiber intake. You've got to adjust your protein intake, all those things. And it still may be that estrogen is, you may need to consider adding back some estrogen to try to offset that visceral fat, which is the fat around your organs,
Mhm.
and that you're gaining, which is that's why we get a lot more central obesity. And the Ozempic, a lot of people do use Ozempic successfully, but they are not using it mindfully, with trying to maintain that the muscle mass, like you said. And so when you lose muscle mass, you also not only do you make your body less stable, like you said, and more at risk for falls, but the muscle is what is pulling on your bone to help you lay down new bone mass. So you've got the double whammy of bone loss and stability loss.
Mhm.
So it really is important to me when I'm talking to, I don't, and I'm certainly not saying, telling patients not to use any of the GLP-1 agonists, but they need to do it mindfully and with good guidance. And if you're going to somewhere that is doing this and without a lot of support for your nutrition, and you just go and you're like, this is the cheapest place I can get this compounded semaglutide.
Mhm.
And they aren't talking to you about protein and exercise, then you're not at the right place
Yes.
because you're ultimately sabotaging your own health, and your 10 years down the road self will be cursing you.
Right,
Like, what
right.
the hell did
You
you
know,
do to me?
you have to approach it like from a mindset that, this is going to be a challenge and that's okay. I'm up for the challenge of, improving my diet, watching my intake of sugar and alcohol and these things that aren't going to, help me in the long run. So again, going back to the mindset and approaching it that way is going to be really key.
Right. It is a challenge, and trying to maintain your health. It's a lot of work, but it's also
Yeah.
expensive. Yeah,
Yes.
good
Yeah.
food is more expensive, supplements are more expensive, and there are some supplements that are important,
Yeah.
good fish oil supplement, vitamin D, magnesium, are some of the things that are super important to maintain cardiac health, help with sleep, help with bone density, and oh, there's some specific collagen peptides that are really helpful for bone mass, and you can't just get anyone. You got to get the certain, you got to get the Fortibone, you got to get the Verisol if you're actually looking for things that have studies that actually are showing positives for midlife women, menopausal women. Um, and but nutrition is expensive too. I mean, eating good food is expensive, and it's expensive in money, but it's also expensive in time and mindfulness of trying to do that. But there's so many good resources out there for and forums, and like we talked about, community. I think that community is one of the most helpful things to say for support in this change in nutrition and the change in exercise.
Mhm.
Find your posse,
Yes.
um, and find people that are going to be accountability, but also you don't have to reinvent the wheel.
Mhm.
Find see what other people have been doing, and more women are entering menopause every day right now than ever before
Mhm.
in history, and we have that ability to connect now through forums like
Yep.
this, but also so find that community because you don't have to do it alone.
Mhm. Very good. I have to ask you though about brain health because I have
Yeah.
seen and witnessed somebody in their 50s with early onset dementia, and it's just jarring how fast that
Yes.
person can rapidly decline. What can we do to kind of like protect and put us on our best foot forward in your brain health?
I love that, and again, there are, when we looked at that Women's Health Initiative study, one thing that came out that was really scary was it said, oh, if you take estrogen, it's going to increase your risk of dementia. But when they actually went back and looked at the studies of women who had, because you are having all these brain changes, and we all feel in the brain fog. When you look at the women who actually started hormone therapy in when they stratified out the women that started in their 60s versus the women that started in their 40s and 50s, uh, they actually had less dementia. So if you protect your brain earlier, you have decreases in change in those brain changes that can lead to dementia. Dementia, I think, is one of the scariest things to all of us because losing that ability for cognition or seeing your family go through it um, is terrifying.
Mhm.
And there are definitely things you can do in terms of exercising your brain, which we know that if you look at the studies on um, women who are there's a study that on there was a TED talk on they 600 um, nuns donated their brains to science, and they looked at them, and there was and they had a much lower rate of dementia in their community
Mhm.
of women, and they looked at their brains, and they actually still had a lot of those Alzheimer plaques, but because they were meditating all the time, they did a lot of memorization, meditation. They feel like that those pathways were the plaques were bypassed, and new pathways were found, and that's the theory of why they had so much a lower rate of dementia, even though when they looked at their brains, there were still Alzheimer's plaques there, like you would see, but their neural connections were still intact. So if you things like mindfulness, meditation,
Mhm.
learning a new language, doing mathematical challenges, all those things that are going to reconnect your neural paths, create new neural paths.
Mhm.
Um, there are tests for Alzheimer's risks and the Alzheimer's genes, and so if you have any kind of risk for early onset dementia, it would be you it's kind of a double-edged sword. So some people feel like they want to do that and do everything they can to help prevent it. They if we look at that, and some people don't. Yeah, if you do know, then you can be even super more proactive. But diet makes a huge difference too. So you adding greens to your diet. Have you ever heard of the Mind diet?
I've
Have you looked
heard of
at that?
it. Yeah.
So the Mediterranean diet, which
Mhm.
is a lot of healthy fats and lean proteins and fiber, uh, is shown to be healthier in all any number of ways.
Mhm.
But when they looked at adding 7 servings of leafy greens per week, it decreased these people's brain age when again they took out their brains and shot
Mhm.
them up. And they looked at the slices that it decreased their brain age significantly and then decreased their risk of dementia tremendously. So diet and making sure that you're getting a diet that is low in saturated fat, high in good fats, low good protein, but the green leafy greens is going to help to prolong your brain health, but also sleep. Sleep. Sleep is one of the biggest ones and one of the biggest problems for women. So there are things like magnesium L-threonate,
Mhm.
is does cross the blood-brain barrier.
Mhm.
I have links that I send to my patients all the time. One is uh, a brand called Neuromag. I don't have no affiliation with them, but that is just one that's easy to find on an Amazon near you. And magnesium L-threonate is one of the other things that can be neuroprotective and help with sleep. And sleep disruption, again, if you are able to use hormonal therapy, progesterone helps with anxiety. It also helps with sleep, so sleep quality. It's not perfect for everyone, but it can help tremendously for some people who find that sleep disruption is mostly from hot flashes and night sweats. But if you find also the other thing that a lot of people don't realize is sleep apnea increases tremendously in menopause. And
Mhm.
there's lots of different theories about that, like where with the changes that affect the looseness of the tissue in that space that makes the snoring.
Mhm.
But they if you if you don't have a partner who might notice that you're snoring or having changes in the your breathing at night, do a sleep study and find out if sleep apnea is a significant problem for you, because that is going to impact your brain function and your brain aging tremendously.
And lower your life expectancy.
Yes, yes, exactly. Basically, what sleep apnea does is it decreases you're not breathing, so you're not getting oxygen to your brain. Of course, exercise of any kind helps with brain age and brain function. And those are the main things. So sleep, nutrition, exercise, pretty much all
Mhm.
the things that are good for you in general
Yeah.
are going to be that what impact your brain aging.
Yeah, it's definitely an age where I think the pause, the menopause, it is a pause in women's life because
Mhm.
maybe you haven't focused enough on yourself, maybe you've been taking care of everybody else around you, and it really forces you to pause and think of yourself because you do have a lot of challenges. We pointed out there's challenges with this, but it's how you face them and not to be in denial, but to face them head on and to and face them with compassion, kindness to yourself, but to also see it as, okay, you can handle it, you can do it, you can do hard things, and at this age, better at any other age.
Mhm. Yes, we have the wisdom now, and I think wisdom is one of the things that I like best about this menopausal age is you wisdom to me means that you are able to sort through the things that are important to you and look back at the things that have informed your life experiences and really make the choices now
Hmm.
based on those things and the wisdom you've acquired, so
Yep, yep, and I love seeing women that do that, and I'm witnessing it more and more because it's in my age cohort right now. So we're getting here toward the end. Do you have any like final thoughts you want to share with the audience about maybe some positives of menopause?
I think that the main one is that, uh, just in the last 3 years, I have been able to really focus. Now my kids are one's married and one is in her last year of college, and it's now the time that I am able to go out and see it and focus on the projects that I think are important to me. And that being able to harvest that uh, impetus and capacity to see what I want to leave behind in the world is one of the biggest gifts of menopause is saying this is my time to really make the most of myself and my interaction with the world and where I see it going. So I think that is the biggest gift of menopause is that ability to have it, the introspection and the power to move forward with what you want to do.
Yes, yes. And thank you so much for what you do and all that you're doing out there
Yeah,
educating everybody. I know you are also a speaker on a lot of women's topics, so I hope to see more
yeah.
stuff of yours online.
All right. Well, take care. And I've really enjoyed talking to you. And I hope that you and all the rest of your Houstonians will enjoy some of the talk and really find some power in themselves.
Yes, yes. Thank you so much, Dr. White. And if you
All
guys
right.
like
Take care.
this video, give it a thumbs up. Don't forget to subscribe and leave a comment down below. Thank
All
you
right.
for watching.
All right. Take care.